Hi, everybody, and welcome to this episode of the Preventing Decline podcast, where we cover a number of topics, everything you need so that as you age older with more confidence, more independence, and you and your loved ones get to prevent decline. So today we have a very special guest, Dr. Jaime Wilson, who is a neuropsychologist. Did I get that right?
Yes.
All right. So we got a pretty smart guy with us today who understands how the brain works, our feelings, our emotions. And I know you've got your own unique take on what it takes to prevent decline. So thank you very much for being here today.
Thank you so much, Dr. Darrow, for inviting me to be on the podcast. I really appreciate this opportunity to be able to talk about cognitive decline and also the book that I just released about that topic. So thank you for having me here. I'm excited to talk to your audience.
Well, I think you have such a unique perspective, right? Because you understand firsthand what happens to the brain as we get older, right? So you get the concept of normal aging, mild cognitive impairment, dementia. And I hope you don't mind me saying this because I know it's going to come up at some point, but not only do you have that level of expertise, but you also live with hearing loss. And so I think you've got a unique perspective on this.
Yes, I do have a profound level of hearing loss. And, I'm so glad to be talking to an audience of audiologists because, everybody that, especially those that have the excellence in hearing loss, certification, audiologists, hearing specialists, hearing aid specialists, all of those individuals, they understand what a profound hearing loss is. It's the most severe form of hearing loss. And, it's interesting because when I was about a year old, I started mouthing words without any sound coming out. And that's when my mom knew something was wrong. So she took me to the audiologist, and I was diagnosed with a profound level of hearing loss. And one of the recommendations that the audiologist made was that I go see a speech-language pathologist and start working on speech therapy. And it's kind of funny because back in the late 70s, early 80s, they would put peanut butter all over my face. They put peanut butter on my cheeks and on my nose and on my chin, and I had to lick it off. And the theory was it was supposed to make my tongue more strong so I could pronounce words better. I don't know if it worked, but it made me a big peanut butter fanatic. I love.
Well, look, this entire podcast could be about what might be wrong, what might be considered wrong about that today. Not only peanut allergies. I mean, I got to tell you, I've been in this field a long time. That's the first time I've heard of that. But it doesn't surprise me, right? Because the concept there being, how can we strengthen your ability to communicate? And I have to say, and this is going to sound strange, so take it the right way. Your mom being able to notice at 1 year old is actually huge, because prior to the advent of infant hearing screenings, which was only in the 90s, the average age of diagnosis for a person with hearing loss, or I should say a child with hearing loss, was more like 5 years old. And so you actually got treatment very early on, which was extremely critical for language development, learning, and perhaps why you're such a smart guy who has a degree in neuropsychology.
Yes, you are exactly right about the development of language. We have a critical period. It is so important that individuals receive language exposure between the birth and 5 years of age. That is what's considered to be the window of critical language exposure. That's when the mind absorbs language the most. And after 5 years of age, that window starts to close. And this is a critical part of one segment of our deaf and hard of hearing population. Now, it's interesting, the field we work in, especially considering those with hearing loss, there's so many different types of hearing loss. We have individuals with late onset hearing loss, individuals that have they're born with their hearing loss, or they develop meningitis at 2 years of age, or rubella, or cytomegalovirus. They have something that's caused their hearing loss, maybe at a younger age, 2 or 3 years old. But it doesn't matter the segment of that population of individuals with hearing loss. We still have a we're finding the research over the past 40 years has shown that if an individual has late onset hearing loss or early onset hearing loss, there is still a connection with cognitive decline in the later ages. We still have a 24% increase. Now, the statistics, they vary depending on the research, but generally speaking, there's about a 24% increased risk of cognitive decline. That's why it's so important that our population understands.
I think you just hit the nail on the head, right? Scientists will continue to debate, research will continue to evolve to help us get to, dare I say, the exact number. But what is unequivocal and undeniable is that hearing loss increases the risk of cognitive decline. Now, I want to challenge you on something. You talked about the critical period, the critical window for children to learn language. And it made me think, first time I ever thought about this. What do you think about a critical window for treating hearing loss in older adults to help reduce the risk of cognitive decline, right? So look, there are 227 million adults in the United States who either have documented hearing loss or what's called subclinical or early stage hearing loss. So that's pretty much all adults over the age of 50, right? It's a astounding number. So what do you think about a critical window for addressing that hearing loss to reduce the risk of cognitive decline?
And, that was the next point that I was hoping you were going to ask me about. That's a perfect segue there. Those individuals that miss that critical period. Now, there's a lot of individuals that miss that critical period. And what tends to happen is that these parents, when they have a deaf child, 90% of deaf children or children with hearing loss are born to parents that can hear. 90%. 10% are born to deaf parents. And that just kind of turns Alexander Graham Bell, his eugenics movement on his head, because he thought, he didn't want individuals with hearing loss to marry each other because he was afraid that would create more individuals with hearing loss, but it actually did not. So, 90% are born to parents that can hear. And so a lot of these parents, they have never had a child with hearing loss, and they've never met a person with hearing loss. So they don't know what to do. And they're relying on the person in the white coat, the doctor, to tell them what to do. And a lot of times, there is an emphasis on, do you want your child to become like you? If you want your child to become like you want to teach them how to talk, how to communicate verbally, orally. And so these parents, they go and they teach them, they raise their child to communicate verbally, and they, also receive instructions. Do not teach your child to sign, because if you teach your child sign language, then they're going to rely on that instead of trying to develop speech, reading, or communicate verbally. And what happens there is that these parents are following speech therapy. They're not teaching them signs. So they go from birth through 5 years, 6 years, 7 years, 8 years old. By the time they're about 8, 9 years old, they miss that critical period. And the parents start to see, oh my goodness, my child cannot communicate verbally. So I think I better put them in a deaf school, or I better start teaching them American Sign Language. And so that's when they start to get access to a reliable language. And so what we have here, this segment that you're referring to, this population, is called language deprivation or language delayed population. And this population does have an increased risk of cognitive decline over and above those individuals that are born with a hearing loss and maybe were exposed to sign language early on, but there is still an increased risk. But language deprived or language delayed individuals do have a greater risk. So yes, that is very true what you're talking about there.
So that's just fascinating to think about how important learning language is, how important it is to be in a sound stimulated world. And look, I do not want this discussion to dive into the debate of capital D deaf community and culture. I respect that. I think more diversity, the better. What I want to talk about, because I think it's fascinating to think about children and hearing loss and future risk of cognitive decline. Let's talk about, though, and you've referred to it as the golden years. My own grandmother always said, the golden years are for the birds. That was always her expression. And you talk a lot about preserving the mind. Tell us more about that.
So there are a number of different factors we can do to preserve and keep our mind as sharp as possible into those golden years. Those are the years we want to be enjoying. And one of those things is very important. And you mentioned that in passing, that it's so important to be able to have stimulation to the brain. We want stimulation, whether it's through hearing, we want that stimulation through hearing aids, or we need that stimulation for those individuals that have late onset hearing loss. Even for me, somebody that was born with my hearing loss, it's important. I wear hearing aids here. I've got Phonak hearing aids, Phonak Sumo. Hearing aids were back 5 years ago when I got them. They were the top of the line in the market. And some of the most powerful hearing aids for individuals with profound hearing loss. But, hearing loss, because it's considered to be, I think it's like one of the top, is probably number 3 or number 2, unaddressed healthcare issue. It needs to be addressed. And we talk about cognitive decline. Half of Americans don't know they have a diagnosis of cognitive decline, dementia. And then half of them may have a diagnosis of it, but they're not told about it. Okay, that information is not communicated to them. And so it becomes so critical for us to be able to recognize it early, because anything in the medical setting, whether it's diabetes or heart disease or cancer, the earlier we catch it, the better. And so it's very important for us with the individuals with hearing loss, if we are able to catch it early, treat it, and ensure that we're doing other things, because hearing loss, once we treat it, is considered to be the number 1 modifiable risk factor for cognitive decline.
I'm so glad you said it, because I'm getting sick and tired of saying it. And I feel like people look at me sometimes like you're crazy, but it's true. This is the data that's out there. This is the data that has come from some of, if not the most world-renowned, scientifically respected journals. This isn't coming from a newspaper. These are world-renowned scientists that have come together and said, look, 40% of all cases of dementia are considered preventable. And if you want to know what you can do, here's a list of 12 things. Guess what's number 1? And not by a little bit, number 1 by a lot, is the early treatment of hearing loss, right? And so it's so refreshing to hear you talk about that. And I know that this is in your book, and I think by the time this podcast is published, the book will be out there, Preserving the Etchings of the Mind, Aging, Dementia, and Hearing Loss. What motivated you to write this book?
So one of the big reasons why I decided to write this book here is because I'm very passionate about ensuring that there is equal access to healthcare information. Now, individuals with hearing loss, they don't have access to healthcare information in the same way that individuals that can hear can. There's a number of reasons why there's a roadblock. There's a number of reasons why there are obstacles to healthcare information for individuals with hearing loss. One of the number 1 reasons is that, a lot of individuals with hearing loss, they don't have the easy access from, bystander information. Maybe you hear other people talking about it. They don't have access to that. And there's also research out there that shows that individuals with hearing loss, their healthcare knowledge is not up to par. It's not comparable to individuals that can hear. And part of the reason for that has to do with their language delay or language deprivation. They're not able to access the information, whether it's through the news, there's no captioning available there, or maybe some of the information is written at too high of a level. The average reading level is about a fourth grade level for a deaf or hard of hearing individual. And when I wrote this book, I wanted to make sure that I wrote it in a way that would be accessible to the lay public, but also be applicable to individuals that are professionals, healthcare givers. So this is also written for physicians. It's written for general healthcare providers. And another big issue we have is that there's not a lot of memory care centers that accommodate individuals with hearing loss. And so this book, I am hoping that one of the impacts it'll make, and so far it's been on Amazon now for about 1 month now, and it's reached the top new bestseller list already. And it's also been on, it's been used in some of the administrators and policymakers in Washington, D.C. So it's been in the political circle. I've been able to bring this book out there and say, hey, we've got this information that shows that individuals with hearing loss, they're up there for cognitive decline, and they need access to memory care centers, memory care services. And so we need to develop more culturally appropriate memory care centers to allow these individuals with hearing loss to have a place to go to when, if they reach that age where they need access to care. And so I'm hoping that this will help to bring on financial incentives for these places to help set up, train, provide specific types of services for individuals with hearing loss.
What an amazing movement that you're starting. And by the way, please don't ever hesitate to call on me, because this is something that I'm also just as passionate about, and I've written about in my books. And I think what you've experienced with your book becoming a top release, I experienced with my books also. And I'm just going to guess, look, you're a lot smarter than I am. I'm sure your book is written a lot better than mine is. I think it's not necessarily about the writer per se. I think it speaks to the number of people out there who don't have enough information. They're looking for a trusted authority. They don't want to talk about hearing aids. They don't want to get junk mail about buy one hearing aid, get one free, or turn on daytime TV and it's only $200 for new, traditional hearing aids over the counter. It's not about that. This is a major healthcare problem that almost all adults have to face at some point or another as they get older.
It is a major healthcare problem. And I think it's also very important for the public to understand that we need to go to trained providers, audiologists, those with excellence in hearing healthcare certification, all those different things. Those are very important to go to these trained providers to get fitted with appropriate hearing aids. And, for me, I was a little bit disappointed to see the recent changes with the hearing aids going over the counter, because I think that actually, it can be hurtful in some ways, because these individuals are not getting the specific needs met. It's so important that we make sure that, they get appropriate audiograms and audiology testing, and then are fitted with the appropriate hearing aid that works for their needs, that have the most up-to-date technology, because there's a lot of technology involved with these hearing aids.
I think you just hit the nail on the head. And look, the Pandora's box of over-the-counter hearing aids is open. It's not going to be closed. And so all we can do is continue to advocate that hearing loss is a chronic medical condition that requires medical treatment, not just by some over-the-counter widget, right? So let me ask you something though, because you and I think we're on the same pedestal, the same platform, talking about hearing loss and the role of cognition. But you also know there's been this minority movement, if you will, where there have been some articles coming out saying maybe we shouldn't talk about hearing loss and cognition. And before I give my personal view, which I think you know what it is, I would love to get your sense of how you react when you see some articles being published saying, hey, let's not scare people and tell them about the connections of hearing loss and dementia.
It's interesting to me that we have some articles, and I've seen some of those articles. There's been a few that have come out within the last 2 months that have talked about the idea that, maybe we're scaring individuals with hearing loss to thinking they're going to get dementia, and they're starting to, the possibility of maybe if these employers, if they apply for a job and they know that there's a connection with hearing loss and cognitive decline, maybe the employers are not going to hire them, or it's going to force individuals with hearing loss to retire early, or that sort of thing. But I think that the important issue here is, my perspective on this is that knowledge is power. I think that if you are going to empower someone, you need to make sure that they understand all of the risk factors involved. And if they're aware of these risk factors, they can do something about it. If they're not aware of it, if we keep this information from them, I don't feel like keeping information from a patient is actually going to help them. I think the best patient is the empowered patient. That's the best patient out there. If they're aware, I think
you just look, Dr. Wilson, you just hit the nail on the head there, which is it's about educating the public so they can make an informed decision. Imagine telling somebody with pre-diabetes, everything's going to be fine. Don't change a thing. Don't change the way you eat, exercise. Don't change any of those habits, because what if you scare them? I mean, imagine that, right? It's not about scaring. It's about giving the public the knowledge and the information they deserve. This is science. None of this is opinion. This is the science that's out there. It's our job. I believe it's even in our code of ethics that we must educate the public, and then it's up to them, right? Ultimately, yes, everybody has the right to make their own healthcare decisions, but only if they have all the education laid out for them. Otherwise, they're making decisions based on lack of knowledge, and that can be very detrimental.
That could be very detrimental. Exactly. These individuals need to know that cognitive decline is associated with hearing loss. This has been the fact for over 40 years. We've had research going back to the early 1980s to show this. And if these individuals are aware that their hearing loss increases the risk of cognitive decline, they can be more aware of other things they can do. There's a lot of other things you can do besides, if for the right person, getting hearing aids, getting fitted with hearing aids, that's important, but also maybe doing brain stimulation exercises, engaging in physical exercise, making sure that your diet is good. The Mediterranean diet is highly recommended in medical circles. Watching your blood pressure, getting anti blood pressure medications if you need it, to keep your blood pressure under control. I mean, there's a lot of different things that you can do. And for those individuals that are not aware, they may not pay much attention to those things. So we need to make sure they're aware so that they can make lifestyle changes when they need to, and also get their hearing loss treated when they need to.
Exactly. Could not say it better myself. You just highlighted that there are 12 modifiable factors. Treating hearing loss is one of them. And I think some of the ones on the list are obvious, right? Whether it be alcohol, whether it be diet, obesity, diabetes, cardiovascular disease. And the only reason I say it's quote unquote obvious is because there's been so much public advocacy. There's been so much education put out there into the general population. So people in general know that their diet affects their heart and affects their brain. Their heart affects their brain. Our job is to now get the information out that your hearing or lack of hearing affects your brain. And studies tell us addressing that hearing loss may significantly reduce that risk of cognitive decline. That is our job, not to scare anybody, but to empower people.
It is to empower the patient.
Dr. Wilson, I am so grateful that you came on today's episode. Can you tell people, you said it was on Amazon. Is that the best place to get your new book, Preserving the Etchings of the Mind, Aging, Dementia, and Hearing Loss? How can people find that?
So you can find that book on Amazon. I will tell you, however, because this month is Deaf Awareness Month. I don't know, for especially the capital D deaf population. September being Deaf Awareness Month, my book was published by a deaf-owned business, and the publisher is Savory Words Publishing. And if you wanted to support a deaf-owned business, you would probably want to purchase the book from savorywords.com. So you could find the book there. But if you do have Amazon Prime and you want free shipping, that's okay too. You can go ahead and
that's okay. Well, what we're gonna do, Jamie, is we're gonna put links to both Amazon.com and to SavoryWords.com. I have to be honest, I didn't even realize that was a deaf-owned business. And so for people out there who want to continue to support the deaf community and deaf-owned businesses, that is a great place to go. But again, we're giving people options and information. I think this is just another great resource for people to be able to learn about their hearing loss, about the fact that, look, it's not something you did wrong. It's just part of who we are. Some of us are genetically prone to have hearing loss at birth or close to it. And most of us, if not all of us, are going to experience hearing loss as we get older. It's written in our genes. It's not just about being around loud noise or certain medications. It's just part of getting older. And if you want to prevent decline, treating hearing loss is perhaps the most important thing you can do. Dr. Wilson, any parting words for our audience?
I wanted to say thank you so much for having me here on this podcast. I really appreciate this opportunity to be able to connect with you and share this information about the cognitive decline in hearing loss. Connection is just a critical, very important part of healthcare that needs to have more emphasis on all levels of healthcare, including political circles.
Dr. Wilson, thank you so much for your time. I greatly appreciate all the work you do. Very excited to share your message and your book with my audience. Have an amazing day.
Thank you.